Hey there, I'm Dr. Monahan from Monahan Dentistry and Implant Center. We are a full-service dental office right here in Mesa, Arizona. Now, today we're talking about a super important topic, which is dental fillings. So today I hope I can answer all the questions you might have about dental fillings so you can have a better understanding about this topic. Now, the first question we get is, what are dental fillings? So a dental filling is a treatment for a cavity. Cavities happen when bacteria or other things are able to erode small holes in your teeth. Those areas need to be cleaned out, and obviously you can't leave a hole in your tooth. That'd be detrimental and you could lose a tooth that has a hole in it. So once the cavities are cleaned out, we fill that small hole back in with a filling material. The filling is meant to reconstruct your tooth and make it look like new again. So if you've never had a filling done before, your next question is, how can I avoid getting a filling done? Now, it is true that some cavities can be treated without doing a filling. The key is that we have to catch it early enough when that cavity is small. We use minimally invasive techniques so that we would never do a filling on a tooth that could otherwise be treated with less invasive options. So if you think you might need a filling done or you had a small cavity, definitely come in so we can check to see if you're a candidate for other minimally invasive options. In particular, in children, I want to make sure we avoid anything invasive. We want children to have a very good and happy experience in the dental office, and there are some really cool and modern techniques that can be used to avoid fillings. Now, in some cases, your cavity might be so deep that there's really no way that you can avoid getting that filling done if you want to keep your tooth. Now, some people get nervous about the drilling. Now, drilling is a way that we can remove the bad or the infected parts of your tooth and get it cleaned up before we put a filling in. But is it possible to do a filling without drilling? And the answer is yes. Especially in children, there are techniques. One of them is called the smart filling technique, and that involves us applying a special medicine to the tooth, and without doing any drilling or numbing the tooth whatsoever, we're able to pack the filling right on top of that. Also, coming in 2025, there is a revolutionary treatment that was just released that allows us to remove tooth decay without doing any drilling whatsoever. And primarily that's going to be for baby teeth, but that also may apply to some adult teeth. So if you're wondering if you or your child might be a candidate for some of these alternative techniques, definitely give us a call so we can schedule a consultation. So if you have to get a filling done, what are the different types of filling materials that are available out there? Back in the day, the most common type of filling was silver mercury. Nowadays, most people opt out of silver mercury because of concerns with the mercury or that they just don't like the looks of having a silver filling in their tooth. So here at Monahan Dentistry, we use exclusively the white fillings. White fillings can be made of two different kinds of materials. The first is called dental composite. Dental composite is very effective, it's very quick, and it's generally really easy to have composite done. It can be sculpted actually right in your tooth to make it look like a virgin tooth again. The other type of white filling that can be done is called a porcelain filling. Now, porcelain fillings involve a little more of a process where we prepare your tooth, and then we can take a 3D image or an impression of your tooth, and then we can create the porcelain material outside your mouth and then have that cemented or glued onto your tooth. Again, in the end, we want either of those options to pretty much look and feel like a virgin tooth. Now, another kind of dental material that you might have heard about is gold. Gold was really popular, especially back when gold was a little cheaper, and gold was actually really compatible with your bite. It was soft enough to form to the tooth, and it performed very well. I've actually seen old gold fillings from 70 years ago that are still in a person's mouth. Generally, nowadays, people don't opt for gold fillings because they either don't want metal in their mouth, they don't like the look of it, or gold is just too expensive because the price of gold has gone up so much. So again, most people are going to want white fillings because they match their natural color. So in the end, our goal is to make a very aesthetic or cosmetic product that you're going to be very pleased with, and then it's going to blend very naturally with your smile. All right, so now for a more serious question, and that is, does it hurt to get a dental filling done? And the answer is no, it should never hurt to get a dental filling done. Now, we can't promise that you won't feel anything, but whatever sensations you feel should not be pain. You might hear some things or you might feel some vibration on your tooth, but there should be no pain. Nowadays, there's really no excuse to have pain during a dental procedure. Even if you are a very anxious patient, we have options for you to be able to go to sleep while you are getting a filling done. But even in the most common situations, we should be able to numb your tooth very comfortably so you don't feel any pain during your procedure. I always remind my patients, okay, we're going to get started, and if you feel any pain at all, raise your hand, because if you get pain that's more than like a 1 or a 2 on a scale to 10, you should stop the procedure immediately and make that tooth comfortable. So it's very important that patients feel like they can express any concerns to their dentist, because you would never want to have a procedure done that was uncomfortable or that was being done beyond what you thought you could handle. Okay, so once your filling is done, can you brush your teeth right away? Yes, so you can go home and brush your teeth right away after doing a filling. The nice thing about the filling materials we use is they set up right away. So as soon as the numbness wears off, you can go home and eat a regular meal. Now, as a side note, if you're still numb after a filling, don't try to chew anything, because you could bite the inside of your cheek or your tongue and not even realize it, and then you'd get a sore later. So wait until the numbness has worn off, and you can go home and you can chew just like normal, and you can brush your teeth just like normal. So the fillings are ready to go as soon as you leave the office. Now the next question is, how much do dental fillings cost? So the cost of a dental filling is going to range depending on a couple of factors. Number one is, how many parts of your tooth are going to have the filling done? There's such thing as a one surface filling, which is very simple and straightforward, and that's going to have the lowest cost. And then they go up even to a 4 surface filling. So the more parts of your tooth that need to be filled, generally the more expensive your filling is going to be. It also depends on if you have insurance or not. Dental insurance companies don't usually pay for all of the filling, but they pay for a portion of your fillings. So what we'll do is, if you have insurance, we'll calculate your estimated insurance benefit so we can see exactly what the filling would cost before we start the process. Okay, so if you think you might need a filling done, when should you schedule your appointment? My best advice for you would be, schedule your appointment as soon as possible. Now the reason for that is because, like I mentioned, the more parts of your tooth that need to be filled, the more expensive your filling is going to be. Also, I tell people, I would rather have, if I'm going to need a filling, I'd rather have a small hole drilled in my tooth right now as opposed to a big hole drilled later. Cavities are like a little tooth cancer. Now, what I mean by that is that cavities start small and they grow slowly and they erode into your tooth. And most of the time you don't realize there's a cavity there until it's too late. So let's find your cavity early when it's small, and maybe we can even use alternative techniques and avoid the whole filling altogether. But if you need a filling done, you want to select a dentist that's very mindful of the small details. Fillings are very detail-oriented techniques, and we want to have a filling in your tooth that feels and looks very natural. So again, if you need a consultation or if you think you might need a filling done, give us a call. The number here is 480-764-2111. Again, I'm Dr. Monahan from Monahan Dentistry, and I look forward to meeting you soon.